My name is Krista Carr, and I'm the Executive Vice President of the Canadian Association for Community Living. CACL is a national federation of 13 provincial territorial associations and over 300 local associations across Canada, working on behalf of people who have an intellectual disability and their families. Today is Friday, and it's our fourth update on what we are doing during this COVID-19 crisis to support, represent the interests of, and address the concerns of people of an intellectual disability and their families. And today we're going to focus on frequently asked questions. Since this crisis started, our inboxes have blown up with people emailing with all kinds of different questions and concerns. And today we're going to try to address some of the things we're hearing most about. And first off, it's the financial crisis that people are facing right now. The additional costs of disability are very difficult and important on a good day. But during this crisis, those costs have really gone through the roof. And people with an intellectual disability and their families and other people with disabilities across this country are really, really, really in need of some financial support at this time. And we are one of the only marginalized populations at this point that has not seen a financial announcement. Well, I need you to know that CACL and our provincial territorial members across the country have been working really hard on this issue. This is an issue that is shared between the federal government and the provincial territorial governments, and both have a role to play in ensuring that people with disabilities and their families get some extra financial support at this time. From CACL's perspective, we've been working hard with Minister Qualtrough, the minister responsible for disability inclusion, as well as Minister Morneau, the Prime Minister, and others, making the needs of people with an intellectual disability and their families known in terms of the financial costs they're bearing right now that are simply crushing. And our federation across the country and the parents and individuals they support, along with allies, have been sending letters to federally elected politicians, as well as provincial and territorial politicians and governments, and to make these needs known. So we want you to know that we're really working on this issue. Secondly, hospital visitation, essential visitors, being able to have somebody with you in the hospital, if you need support for communication, to understand information, etc. We get so many calls about people being denied access to loved ones in the hospital, whether they go for COVID or not. I want to remind you again of the Public Health Agency of Canada guidelines that I talked about in my update last week that were released. They are on the CACL website, www.cacl.ca. They're guidance documents for health systems across the country. They come directly out of Public Health Agency of Canada on COVID and disability. And it's very clear in those documents that people are able to have somebody with them when they go to hospital. They need to be able to have somebody with them who can support their communication, who knows them well, and who can help them understand information, support them to make decisions, etc., etc. And thirdly, we get a lot of questions about the new student benefit, the Canada Emergency Student Benefit that was announced, and how you qualify. So that program is administered by your own declaration of disability. You self-declare that you have a disability. You do not have to be eligible for the disability tax credit in order to be eligible for the Canada Emergency Student Benefit disability component, the extra top-up. That is for people with disabilities. You do not need to be DTC eligible for that. So please, thank you everybody, and stay tuned for next Friday. We'll be back with more updates. Have a wonderful weekend.